Stu, you're now live.
Good evening, Mono County, and welcome to the COVID community conversation for November. My name is Brian Wheeler from Mono County Public Health, and I'll be your host tonight. Apart from our normal cast of speakers, we do have some special guests with us tonight that we'll introduce as we go along. So we have a lot of material to cover, so let's go ahead and get started. Stu?
Thank you, Brian, and welcome everybody to the community conversation for November 5th. We're just going to walk you through some of the similar slides you've been seeing in the last presentations, and then we have a new update regarding our case counts and our metrics, and then we'll walk through kind of where we're at in Mono County, the path forward, and we'll get to the questions and answers as soon as we can. But again, stay safe to stay open is our hashtag campaign. Really want to make sure it's more than just a hashtag. It needs to become a way of life. We also want to make sure that everybody's aware of the new county order that was issued on October 22nd. That means gatherings from different household units up to 12 persons from a maximum of 3 different households is the new order. So we want to make sure everybody's adhering to the maximum gathering requirement. We want to make sure that you continue to wear a face covering and recreate responsibly. And again, together we can help keep our communities healthy and safe, reduce transmission, and prevent spread. A couple of programs we want to update you on. This is the Mono County Cures program. Applications ended October 20th. There's 300,000 available. Awards will not be exceeding $10,000. And again, any more information about that program, please contact Jeff Simpson or Alicia Vanos there on that 800 number. The round 3 of the Town of Mammoth Lakes Business Assistance Program, up to $100,000 in total funding, closed on October 11th, and grants will be awarded on November 13th. Again, any information can be found on the Town of Mammoth Lakes website. Mammoth Lakes Housing Community Donation Drive, seeking up to $300,000 to support much needed rental assistance payments through December 20th. Through December 2020. So far, 16,600 in private donations have been raised. So thank you, everybody that's made a donation. Again, more information about that program and how to donate can be found on mammothlateshousing.org. Public health COVID-19 testing for the week of November 9th, Monday, Wednesday, and Thursday. Public health testing from 10 a.m. to 1 p.m. Testing up to 40 people a day. So that's down from 70. So if you do want to get tested, we ask that you do get there early. So again, Monday, Wednesday, Thursday at the Mammoth Lakes Community Center. Tuesday, Verily tests in Mammoth Lakes. And Friday, Verily testing is the Antelope Valley Community Center from 9 a.m. to 12:45. All the testing information can be found on the Mono County portal by clicking on this graphic here on the top right-hand corner. Just want to make sure everybody is still aware and up to date on where to find our local information and resources. If you haven't seen one of these presentations before, we have 2 websites, one English and one Spanish. You can see those on the screen. We have a COVID-19 help email for any questions. Again, if they weren't answered this evening, please email us at covid19help@mono.ca.gov. Town of Mammoth Lakes short-term rental hotline, town code compliance hotline, COVID-19 violations, and our week in review is issued every Friday. Next bilingual community conversation is scheduled at this time for Thursday, November 19th at 5:30. Just want to walk through the latest metrics, kind of where we're at in our case count. You can see here we've had a pretty dramatic increase. This is as of as of today, November 5th. You can see we're up to 336 cases. That's up from 166 from October 1st. 30-day metrics, we have tested 1,125 people, 92 positivity rate, a 30-day positivity rate of 8.18%. That's of October 31st, 2020. And the little graph table there at the bottom, you can kind of see week by week, the number of tests, the number of positive cases, and the week by week positivity rate. That is represented here in the percent positive rate by week. You can see from mid-July, we started at 9.25. End of August, beginning of September, We were doing great down there at 0%. Thank you for everyone's help and compliance, staying safe to stay open. And then most recently, at the end of October, we're climbing up in the wrong direction, over 14%. Mammoth Hospital status is green, and we understand there are no COVID-19 hospitalized patients at this time. This graph here just depicts the number of cases that we'll talk about in a sec from the Marine base versus the cases in Mono County. Again, this is over the 2-week period, beginning October 18th to October 31st. And all of these metrics and more can be found on the COVID-19 portal under case stats, which is that graphic, the little graphic at the top right-hand corner of your screen there. So on the homepage of the website, click on the case stats graphic, and you can see all these graphs and more. Just want to spend a little bit of time covering the blueprint for a safer economy. The framework lays out the measures that each county must meet based on the indicators that capture disease burden, testing, and health equity. Counties are assigned a tier based on 2 metrics, test positivity and case rate. Currently, Mono County remains in tier 3 or orange, which is where we started in August. This slide here, we want to just cover a little bit, and we'll have personnel from the US Marine Corps Mountain Warfare Training Center provide additional updates to the community. But over the last 2 weeks, Mono County has experienced an increase in cases significant enough to threaten our current status in tier 3. The majority of the new cases are associated with the base in Mono County, in Pickle Meadows there. But the base is working diligently to coordinate appropriate response and continues to work closely with interagency partners, including Mono County Public Health, to monitor the situation and implement appropriate measures to reduce further exposure, both on the base and within the community. This evening, we have personnel from the Marine Corps Mountain Warfare Training Center. I'd like to introduce the Commanding Officer, Colonel Daniel Whitman. Thank you.
All right, good evening, everybody. I appreciate the invite today to talk about this important topic. So about 30 days ago is when we kicked off the Mountain Warfare, our current exercise with a unit from Camp Lejeune, North Carolina. We have about 1,500 Marines that are currently conducting training here at Pickle Meadows. And there's 3 different units that came over, and all of them are from the East Coast. The Marines that came over, many of them were asymptomatic. There were some Marines that were sick with COVID, and they tested, and they were held back at Camp Lejeune. However, when Marines flew over here and got to our training base, over the next week or so, those folks that were asymptomatic, that had no reason to be tested, became symptomatic. And we're in close proximity conducting their training here. So we were out in the field, sleeping in 2-man tents and moving around the training area. So over the next kind of 3 weeks, we've had this significant spike in the number of COVID cases because the Marines have been in close proximity, some of them asymptomatic and some of them symptomatic. As soon as we had a Marine that was symptomatic, we would test them using the PCR kits, which are the 72-hour kits. That we'd test them here. We'd send them out at 1,400 down to Reno. And then 3 days later, we would get the result. So as soon as we had somebody that was symptomatic, we'd place them in something called isolation, which is in one of our berthing areas or one of our barracks. It's down in lower base camp. And then when they came back COVID positive, they would go into isolation. And currently they're in a 1-man tent across the 108 on the south side of the 108 and completely separated from the rest of the exercise force. Unfortunately, over the last, as we continue to get more cases, we decided, hey, we're gonna test everybody in the entire unit. So I think we ended up testing a total of 1,300 Marines and sailors that were out here conducting training. So as you might expect, we did that on Monday and Tuesday to just get a better feel for exactly how many folks that we had that were sick, that were either symptomatic or asymptomatic. So what's happened over the last 2 days specifically is yesterday we had 66 Marines that tested positive. So that we tested them on Monday, Tuesday. Yesterday we got the first batch of tests back. I think we had 488 tests that came back, and we had 66 folks that were positive. So they were already in quarantine because they were symptomatic, and moved to the south side of the 108. Today, our most difficult day, we received more COVID positive. So about 90 additional cases of COVID-19 folks that once again just came off the hill, that were up there training, Some were symptomatic, some were asymptomatic, were pulled off and put into quarantine on the south side again. So those are the numbers of what we've seen. These are not Marines that are going out in town. They're not down in Walker or Colville or Bridgeport. They're in Pickle Meadows. They're not allowed to leave the base. And what we foresee happening with them is they will stay in quarantine for 2 more weeks. We have medical personnel that are watching them and making sure they get both the medical care, obviously food and what they need there until they get through the 10-day period here, the 2-week period when they can come off. If they're feeling better, that they can come off the hit list, so to speak. So that's kind of where we're at today. We have had a total of 15 either Marines, so 9 Marines, 1 civilian police officer, and 3 either spouses, and then we had 1 child that has been infected by COVID-19 as well. None of those, the child is a baby, and they actually got COVID-19 on the East Coast in North Carolina and flew back and were put into quarantine. The spouse was the spouse of one of our police officers, and we also had 2 spouses that were some of our Marines that got COVID-19, were asymptomatic, went back home, and then infected their families. All those families have been put in quarantine in the housing area and have gone through our safety protocols. One went to the hospital, had fairly severe reaction, and has come back and is back in quarantine, back in their houses. So the thing I want to highlight to you is all of our instructors are currently up on the hill. We've been doing training for the last 2 weeks. And so people aren't really going back and forth home. They've been up on the mountain training our Marines. And then the Marines that have been sick are either quarantined here on the base or they're quarantined inside of our housing area that's back there at Colville. So that's kind of the current situation right now. What we're trying to lobby for through our military chain of command is that our numbers that we have added, significantly to the Mono County numbers, is that we should be looked at as a enclave inside Mono County. We're isolated. These Marines came from Camp Lejeune, North Carolina, and the COVID virus came with them. Before this exercise, we had 0 COVID cases with the Marines that are stationed here at Pickle Meadows, which is about 400 Marines and sailors and civilians. And so we're asking for this to be looked at. And by the way, those same Marines will finish up the exercise here in the next 48 hours. And then within 2 weeks, they will all go back home to North Carolina. So we're asking for this to be a bit of an anomaly, for this not to be considered part of Mono County's numbers, and that when they fly back out of here, that Mono County does not suffer because of the military bringing COVID from the East Coast to the West Coast, which most certainly has happened in hindsight. So with that, I'll open it up to any questions, or Adrian, if you have anything else that you would like to add. Over.
So thank you. I don't have any additional comments. I think you pretty much covered kind of the situation as exists today, as well as how it transpires. As you said, everybody I think is either going to depart within the next 14 days because they were scheduled to do so, or after they clear the CDC COVID recovery criteria, then they will make travel back, at which point. And I guess for those that are curious, we don't have an additional exercise scheduled until January. So from then until now, it would just be the base's permanent personnel through the holiday period. I think that's all. I guess it's back over to you, Brian.
Forgot the whole mute thing. Thank you both, and thank you for being here. But now we are going to ask if our chair of our Board of Supervisors, Chair Corliss, are you on the line and ready to speak?
Yes, I'm here. Thank you, Brian.
Certainly.
Yeah, so I'm Stacy Corliss. I'm chair of the Board of Supervisors, and I'm here tonight to assure everyone that the county continues to keep public health and safety as the #1 priority in our COVID response. We are committed to following public health directives, both from our local health officer and the state. And we are really grateful that these Marines and sailors and their families are getting healthy or recovering, and we wish them continued good health and thank them for their service to our country. We are also committed to advocating for the needs of our communities. And what that means in this case is working with the state to prevent movement into a more restrictive tier in the state's blueprint for a safer economy, as a response to this outbreak at the Mountain Warfare Training Center. So simply put, what we're advocating for and what we all agree on here is that downgrading Mono County to the red or purple tier is not the right way to handle this very unique situation. And realizing that it could do more harm than good by causing severe economic and social impacts to our county communities that are already hit hard and devastated by this pandemic. Both the isolated location of the Mountain Warfare Training Center and the nature of the training exercise in which the outbreak happened call for special consideration. So that's what we're asking for. And as you just heard, Mountain Warfare Training Center leadership has demonstrated their ability to handle and isolate the outbreak and to mitigate risk. As you also just heard, they are willing to help with our advocacy for an appropriate state public health response to this outbreak. And some other good news is there is precedent in other counties and situations for this type of consideration. For instance, with outbreaks that have happened in prison populations in other counties. And let's, while this, the numbers can sound scary, let's please remember that the state is our partner in this COVID-19 response and in the provision of all the public health and social services that Mono County provides to its residents. We're in it together, and we can expect a reasonable, thoughtful response. And so I want to talk to you a little bit about what we're actually doing and who we're talking to. So first thing we're doing, and this is a continuation of efforts that have been going on for several weeks. We're working through the California State Association of Counties. That's our 58 county strong advocacy group that helps work with us in Sacramento and DC to set policy and advocate for our needs. So Supervisor John Peters, who's here on the meeting tonight, has been part of a small group of rural county supervisors, meeting with Health and Human Services Secretary Dr. Mark Galley every single week. Supervisor Peters has spoken to Dr. Galley about this situation, about this outbreak, and the need for consideration of the unique circumstances. So he's got a direct line, and you can ask him more questions about that in a little bit if you'd like. And then we're also working regularly, and again, an ongoing effort through public health officer communication channels. Dr. Boo, who of course is here tonight, has been in communication with the other health officers, and later this week, he is meeting with Acting State Public Health Officer, Dr. Erica Pon. I personally have also alerted our state and federal representatives about the situation, was in contact with Congressman Paul Cook's office, and they're aware of the situation. We've also enlisted the help and support of local government partners. Of course, we're working with the Marine Corps on this, and also with our Yosemite Gateway Area Coordination Team, which is a group of public health and elected officials in Mariposa, Madera, and Tuolumne counties. And our regional advocacy efforts have been successful in other situations. So we're really not alone in this, and we're doing a lot, and we're very active in trying to seek a good outcome on this. And like I said, Dr. Boone, Supervisor Peters can probably speak more specifically to what they're doing. But I want to close on this note. This is all good. We'll worry about this. We're seeking solutions. But please remember, this is not our county's biggest threat when it comes to COVID. We are likely to get a good outcome with our efforts with the state in this, but ultimately it's our own actions every single day as residents of this county that will determine our community's well-being. Many places, as you all know, throughout the state, nation, and world are seeing big COVID case increases. And indeed, we've had a local uptick in cases unrelated to the Marine base. So our best protection for our health, our economy, our future is to do what you know you're supposed to be doing right now. Wear a mask, keep distance, wash hands, follow the rules, and let's please be kind and take care of each other. Thanks.
Thank you, Chair Corliss. I'm now going to ask if John Peters, Supervisor Peters, would you be able to speak to us?
Certainly. Thank you, Brian and Stu, Chair Corliss. Colonel Whitnam and Lieutenant Colonel Adrian Arnold. So I just really briefly, because Chair Corliss covered this, but since the middle of September, I was appointed to the California State Association of Counties Rural Caucus Working Group. And as the county's representative to the California State Association of Counties, there's many opportunities for advocacy for Mono County, rural California, and just rural counties, specifically. So in being tapped into this role, I've had the opportunity, along with the chair of this committee, Supervisor and second Vice President of CSAC, Ed Valenzuela from Siskiyou County, Supervisor Denise Carter from Colusa, and our neighbor to the south, Supervisor Jeff Griffiths from Inyo County. And we also have a couple rural health officers and public health officials that are on this advocacy group. And the benefit that we've seen is that we've had the ear of the state of California at the highest levels of health and human services, as Chair Corliss stated, primarily in Dr. Ghali, who we've all, as a collective group on this Rural Caucus Working Group, developed our own individual relationships with him as well. And although we only have met in a group setting up until a couple of days ago, when I began just one-on-one conversations with Dr. Ghali, and specific to the Marine Corps situation. So he has a heightened awareness. He has indicated a willingness to address the unique nature of this through the channels that that take place at the highest levels of the governor's administration. So I will continue that advocacy. I believe, as Chair Corliss stated, we have real opportunity here to identify this as in a bubble. It is not, permeated into our communities in the form of any kind of local spread. So I'm here to answer questions. If you guys have questions specifically about my role or the rest of District 4, of course, District 4 includes the Mountain Warfare Training Center, which I'm very proud to represent the district that are fine young men and women, sailors and Marines train for our national defense. And also it's the home to several schools in the Eastern Sierra Unified School District. And earlier today, there was a directive by the superintendent of Eastern Sierra Unified School District to return to remote learning beginning tomorrow, and to continue that to not return to in-seat instruction at the schools in Bridgeport and the Antelope Valley until at the earliest the Monday after Thanksgiving. This is unrelated to the Marine Corps outbreak. So just if that was going to be a question, I wanted to make sure that was clear. The case that prompted this remote learning pivot was unrelated to the Mountain Warfare Training Center or any of the permanent personnel. So with that, I'll turn it back over to the team and be on standby to answer any questions.
Thank you, Supervisor Peters. And again, thank you, Chair Corliss. I think if Stu, are you done with your slides?
Yes, thank you, Brian. 5:55, we could see how many questions we have and see if the team's ready to respond to the many community questions. Thank you, Brian.
All right, well, let's go to our first question.
In the January 2021 training, will they all be tested prior to and upon arrival in Mono County? And what other changes will you make?
Go ahead, Daniel.
Okay. Yeah, I think I can take that. So we're definitely going to do something different without question. So when we started this exercise, the tests were not as abundant in the DoD as they are today. So only symptomatic folks were being tested. I think certainly based off of what we've learned from this, we now have not only the PCR tests, which are the 72-hour tests that go through LabCorp down in Reno, but we also have the rapid tests. They're called the Bintex. tests, which are that you can do if you have any, you can take it automatically, and you get a result back in 5 to 15 minutes. So the answer to your question will be yes. We will test the folks before they come here, and I think it's going to be a smaller audience, quite frankly. When you think about cold weather in January and February here, and the ability to be able to social distance when you're freezing to death on the side of a mountain, that's going to be really, really challenging. So I think we'll probably reduce the number of folks that are coming up here. Marines will be able to stay in their own single tent as opposed to 2- and 4-man tents. And that we'll have to test on the front side, and then we'll have those rapid tests as well. So hopefully that answers your question.
Thank you, Colonel. Much appreciated. I hope those tents are heated. Ooh, a little cold out there in January. Let's go ahead and move on to our next question.
Can you clarify how many of the 100 tests in the last 2 days are from Pickle Meadows? How many are still pending from Pickle Meadows? And how many positives do we have outside of Pickle Meadows in Mono County?
Colonel and Lieutenant Colonel, would one of you like to answer the military portion of that?
Sure, Brian. I can't answer all of that question entirely because honestly, I don't have a tracking of case counts in Mono County that are outside of the training center here. But I can say that from our permanent personnel, we are currently managing 1 active COVID-19 case of permanent personnel. And then the remaining case count for that, that is reported to the public health office, it's accounted for by our exercise force, the training personnel. So to my understanding, it comprises a large portion of the total case counts, but I would need the public health office to be able to define that percentage.
Thank you, Lieutenant Colonel. Much appreciated. Lauren, what was the public health part of that question?
Brian, I think,
Sorry.
sorry, Lauren, but yeah, Tom Boo, health officer, I understood it to be a question about how many positive tests, how many cases we've had outside the Marine Corps base. And, I think we've had 11 over this week and last week. I think it was 6 last week and 5 so far this week. This week is not over.
Thank you, Dr. Boo. Let's move on to our next question.
How will this affect Mono County, Mammoth Lakes, Mammoth Mountain? And do we have enough cases outside of Pickle Meadows to move us into a new tier?
Dr. Boo, would you like to address that?
Yeah, so outside of the disease transmission at the Marine base, the levels in the rest of the county, including the town of Mammoth Lakes, are below the thresholds that would require us to move to a more restrictive tier. So that essentially is the nature of the discussion that our elected officials and me and the Marine Corps are going to be having, with state officials, basically making the case that what's happening in the Mountain Warfare Training Center does not reflect the situation in the county outside the base, and that it is confined to the base, and that increased economic and social restrictions affecting the whole county, including the town of Mammoth Lakes, would not meaningfully affect. It wouldn't be effective in addressing the cause of the increased rates in Mono County. It's pretty straightforward public health argument, and as Chair Corliss mentioned, I mean, the people of the state are reasonable and thoughtful people. They have their rules, they have their tier system, but they also do not, wish to cause unnecessary economic, and social pain if it's not going to, reduce the risk to the public from COVID-19. So I don't know. You know, I mean, I think the decision will be made at high levels of the state government. But I'm going to have a conversation with the acting state public health officer, Dr. Pond, tomorrow evening, along with some of the other people on this call. And I think we can make a good case that it should not cause us to move into a more restrictive tier.
Thank you, Dr. Vu. Greatly appreciated. I too look forward to that meeting on Friday. Just a reminder to our panelists that this is being translated, so occasionally take a pause so that our translator can catch up. Can we have our next question, please?
When do you anticipate having a response for the state as to Mono County status?
Well, as Dr. Vu just mentioned, we have a meeting on, well, tomorrow in the evening to discuss our situation with the state, and hopefully we will know shortly after that how the decision will come down. I don't think, Tom, they've given us any indication, correct, on a timeline for a decision?
Yeah, so thank you, Brian. My sense is that Secretary Ghali, after his conversations with Supervisor Peters, asked Dr. Pond to reach out to us, you know, with her data monitoring team, and get a very clear understanding of our situation, and that she will then go back to Dr. Ghali. They will discuss it, and they will probably then make recommendations up the chain to the governor's office. And so I'm not sure when we'll know, but there will be no tier change next week. You know, the system doesn't require that. I mean, if I'm going to pause. And you know, but you know, if as we fully expect the you know, the data that the state publishes on their website next Tuesday does indeed indicate that we would normally be moved to a more restrictive tier, there's a process by which we can request what's called adjudication, which would, you know, at least buy us another week for time to discuss, you know, with the state, you know, what our situation is and what the appropriate action should be.
Thank you, Dr. Vu. Can we have our next question?
If our appeal fails, what are the possible repercussions? Can Mammoth Mountain open, Town of Mammoth Lakes dining, etc.?
To you, Dr. Vu.
Okay, yeah, you know, so Stu Brown did share the, you know, the graphic that shows the different activities that are permitted or restricted according to tier level at the beginning, and that is available on the state website. Pause. The state system does not specifically address ski resorts. I believe they're working on trying to figure out how ski resorts should fit into the tier system, but as of now, there's no information in the state system that would restrict Mammoth Mountain from opening.
Which is certainly excellent news. I look forward to skiing, so.
Yeah. And then the restaurant sector, do you want to take that one, Brian? Basically, if our numbers right now are consistent with the most restrictive tier, what we call the purple tier, and that would basically mean no more indoor dining whatsoever. We get back down to outdoors and takeout and delivery options. So,
which in winter for us means more takeout and delivery than outdoor dining, given the weather. And Stu has that up, the tier structure up for everyone to look at. And again, you can certainly see this on the state website, or if you just Google California tiers, it will also come up. Go ahead, Stu. It looked like you turned off your
Thanks,
mic.
Brian. It's listed on the COVID-19 Mono County portal under the Path Forward graphic. So if you're on the homepage, click on the path forward graphic, you'll scroll down and you'll get to a section where you're able to access this little PDF, and it walks you through each and every tier and then the sectors and the modifications / restrictions for each of those tiers. So there you go.
Thank you, Stu. All right, why don't we move on to our next question?
Does the dashboard reflect the rural metrics? The formula listed seems to reflect the original metrics. Can this be changed?
Stu, I'm going to pass that one on to you.
That's fine. Thank you. Can the metrics and formulas be listed so there is transparency? You know, right now, our understanding is that we are including the positive cases from the base into our metrics. Until we hear differently, we will leave them on that case count. We are looking at the opportunity to bifurcate the positive cases from the base and the positive cases from the county. At this time, until we get further direction from the state, from Dr. Boo and so forth, we'll be remaining with the metrics at this time. So if there's direction from the state, we'll take that and update the website as appropriate. So hopefully that answered that question, Brian. Dr.
Great.
Boo?
I did wonder if the question was more about the thresholds, the levels that are permitted from the state, and if that's the case, we could talk more about that. I'm not sure what exactly our website has in that regard right now. Stu would know.
All right.
I think, Brian, if there's a question that person would like to follow up with, so we clearly understand the question, if we're not answering it, please email us at covid19help@mono.ca.gov, and we'll certainly get the response for that person to make sure we're answering that question. So thank you.
Thank you, Stu. Thank you, Stu. And let me just add, I mean, it is a complex system, but it is fully described, including links to the nature of the adjudication process on the CDPH on the state website for people who want to try to understand the different numbers and rates that are allowed, and they differ in terms of going backwards to a more restrictive tier versus going forward to a less restrictive tier. There have been some changes in that regard recently.
And there could be a reference to, I think, Dr. Boo, maybe the question's referencing the small county framework that we're working under as a population under 106,000. I think there's 22 counties that operate in that small county framework, and we have different positivity rates and different case counts based on our population under, I think, 35,000 to move up and down those tiers. So we have that information again on the COVID-19 portal under the Path Forward page.
Sounds good, Stu. Thank you, Stu and Dr. Boo.
Thank you.
Before we move on to our next question, I was hoping that Dr. Burrows could just give us an update from Mammoth Hospital.
Thanks, Brian. The hospital, as things stand right now, is actually not experiencing any patients that are in the hospital related to COVID-19. That does not mean that we have not been busy. We have. Surprisingly, the number of people that have been in town or even just local people that are requiring care is clicking along as if it's a normal year. I will remind everybody, though, that for every uptick we've seen or every surge that we've seen dating back to March, the hospital has seen patients that have had to get admitted. And unfortunately, we've also seen patients that have died from COVID-19 infection. So certainly from my perspective, I look at this and I certainly have my concerns that as we see cases increase, whether they count towards Mono County or not, we're going to see that translate into admissions and potentially people that suffer the worst outcome from this, namely passing away as a result of COVID-19. The Marine base episodes certainly, I think, serve as a reminder to everybody of how contagious this infection is. The virus is not going to take a break for any reason, whether it's shoulder season, the election has come and gone or whatever. It's going to keep pounding away at us. And if we don't continue to be mindful of our need to distance and wash, whether you're Republican, Democrat, or otherwise, it's going to keep coming. So I really would remind people that this is not going away. We have got to stay on top of it and do everything we can to prevent it from escalating into a situation in which it compromises the health of our community and frankly, from the hospital perspective, our ability to take care of people that have this infection.
Thank you, Dr. Burrows. And just looking at the last couple of days, there have been record number of cases across the country. So, you know, I know there's fatigue, COVID fatigue and mass fatigue, but, you know, we got to stick with it to keep our community open, to keep our community safe, and to keep our community prosperous. So thank you, Dr. Burrows.
Yeah, you only have to look in Europe to see what nations that were open and effectively with no restrictions have gone back to. Germany and France, for two countries, are back to very, very strict restrictions about what you can do. So I don't want us to bury our head in the sand and think we're all free and clear. Nations that thought that they were done with this are very much back in the thick of it.
Thank you again, Dr. Burrows. All right, let's move on to our next question.
Are any of the current cases people that feel sick, or are they all asymptomatic?
So some are asymptomatic and some have some symptoms. So it's a mixed bag of both.
Yeah, we've had people happily not have to get admitted to the hospital, but have absolutely been symptomatic that have gotten tested as a result of their symptoms and have tested positive. I would love it to stay that way, that they don't wind up getting super sick, but this is not just a phenomenon of, oh, you tested positive and you know have no symptoms. These are people that are sick, that are staying out of work, they're told to isolate, quarantine. It's still very, very real.
And also, just as a reminder, if you are sick, please, please, please do not go to work. So
Call 211, right, Brian?
that's right. Call our 211 line. Thank you, Stu.
8 a.m., 5 p.m., 7 days a week.
That is correct. Thank you for the plug.
And it's in Spanish.
Yeah, exactly. English and Spanish. Do we have any callers that are calling in?
Yes, we have one phone-in caller. Cleland, go ahead and unmute yourself.
Hi, Cleland.
Hey, everybody. Thank you so much for this. Of course, I'm going to be the burr under the saddle on this one. It just so turns out that in North Carolina, I happen to be 39 miles away. Well, my hometown is 39 miles away from Jacksonville. I encourage everybody to look at a map. Jacksonville is located in a population of probably, looking at the map, I'm guessing 300 to 400,000 people who are within a 40-minute drive, like us going to Bishop. So my question is, I hear a lot of people thinking that it's coming from Jacksonville. So it was 1,500 soldiers or, people on a base, but they were not designated to the base. They were going out to all these different areas on their off time, which were just like a trip from Mammoth to Bishop on a daily basis. So my question is, are we looking at this, if this is just coming from a population from one area coming to Mono County, how are you predicting that all the visitors from all of the other parts of the country will not be tested the way that these people were tested, yet bringing this to Mammoth? Again, as I said, my hometown is 39 miles away from where this is, supposed to have started, but people were not stuck on a base there. They were out in public in North Carolina. North Carolina numbers have gone up. Are we just not going to allow any travelers from North Carolina?
Well, interesting question. Mobility definitely plays a part in the spread of this virus. And, we do anticipate cases over the winter as, tourism presents up here, and that's part of our economy. So we do anticipate some cases. The hope is we can control and contain them as quickly as possible and to keep everyone well and to keep our county open. Dr. Boo, would you like to add to my comments?
Sure. And hello, Cleveland. Thank you. Yeah. So North Carolina has a significant burden of disease and transmission now, but it's not one of the leading places in the country as far as the last time I checked. I mean, COVID-19 is on the rampage throughout the country, and so I don't think it's going to be effective to target any one particular state or geographic area. California, which is our main tourist base, thinking now about town of Mammoth Lakes and Mammoth Mountain ski area. California is doing better overall than much of the country, but some of those Southern California counties have experienced increased transmission. A number of them are in the purple tier right now. And so, yeah, I mean, travel increases the spread of disease. And we've said that multiple times throughout this terrible pandemic. And there are profound risks in being a tourist economy. It would be nice to be able to just hunker down and everybody stay home and stay safe. But our economy is not structured that way. So, we hope, as Brian said, that we can move forward into winter, trying to strike the right balance between safety precautions and restrictions and maintaining economic activity.
Thank you, Dr. Boo. Do we have any more call-ins?
Not at
I'm
this.
sorry, Lieutenant Colonel, did you want to say something? I saw your mic go off.
Yes, Brian, I saw a comment from Stacy that I think is correct, asking about or suggesting that the conditions which are the Marines are participating in training is likely to happen. And I think that's true. Some individuals that travel.
Lieutenant Colonel, I'm sorry to interrupt you. We're having a hard time hearing you. Can you maybe move a little closer to your microphone?
Yes, Brian, is that better?
A little bit.
I was within 6 feet of my boss, so I had my mask on, sorry. No, so yes, Stacy suggested a comment about kind of the conditions that the Marines are training here might be relevant to this question. And she's right, there are some individuals certainly that travel from North Carolina to California while carrying the virus. But the manner in which we conduct training here certainly is a contributing factor to the case count that has accrued so far. Some of the close quarters that we have to put the Marines in, the weather conditions when cold, put sleeping conditions into tents. So the training itself is a challenging environment with which to try to manage the COVID outbreak, so to speak. And then certainly the accumulated case counts that will ultimately be tabulated from within this exercise force, I don't think is an accurate representation of how much risk is associated with interstate travel into and out of California, which is kind of somewhat analogous to, or at least in line with, the argument that the county's making to the state. These are numbers that are separate and distinct from the normal calculus for COVID-19 discussions. And I saw the prompt from the host regarding. I did see the question about which unit from Camp Lejeune. I cannot disclose that for operational security reasons. It's more than one unit, but we cannot discuss precisely which units these cases are coming from.
Thank you, Lieutenant Colonel. Appreciate it. Do we have any more call-ins?
Brian, I don't see anyone else's hand raised on a call-in question at this time.
Okay, then let's just go back to our written questions.
Okay, we have how many cases are within Eastern Sierra Unified School District?
So as far as we know right now, there are no confirmed cases. There have been some potential exposures, but no cases at this point in time. All right. Do we have another question?
We currently do not have any Facebook questions or questions in our Q&A.
All right. Chief McCrassick, do you want to give an EOC update?
From the EOC side, we continue to work with Unified Command and monitor the COVID outbreak as well as the wildfire, the creek fire, and just to keep an eye on that also. We continue to provide support with PPE and just continue our working relationship with public health and social services to meet the needs that are of the people that are displaced through quarantine or isolation. So that's been our focus so far.
All right. And I was hoping that maybe Dan Holler could give us a town update.
Yeah, thank you, Brian. We have wrapped up around 3 of a business assistance program. So those eligible business will be getting a payment here in the next week or so as we wrap that program up. The subsidy for rent and housing assistance is ongoing. We have put some additional dollars into that through a grant and are working on raising some additional funds to assist with that program. We are working on a revision to the lodging order. Hopefully that'll be out shortly here very soon in terms of a little bit of modifications to that element as it impacts our lodging community. And then as with others, we are closely watching and monitoring the impact of the current caseload, as well as continue to watch the creek fire, as we will be in a red flag status tomorrow with the wind event. And we are very excited about a snowstorm coming in this weekend, as that hopefully will have a good impact on Mammoth Mountain and the skiing. And we're working with them very closely in making sure that as they look to open, that they do it safely for their employees, for the community, and for their guests. So, thank you.
Thank you, Dan. Greatly appreciated. Can I get an update from Sheriff Braun and Chief Davis?
From Mammoth Lake's police department perspective, no real major changes, no issues, and just kind of status quo.
Thank you, sir. Sheriff Braun? Ooh, we're not hearing you, Sheriff.
Doubly muted. Sorry about that. Can you hear me now?
Absolutely.
So from the sheriff's office, nothing to report on the COVID front. Everything is status quo. Nothing really going on there. Forest restrictions are still in effect for fires, for campfires, that sort of thing. And we do have a PSPS, a public safety power shutoff possibility tonight into tomorrow for certain neighborhoods. If you haven't heard, then it doesn't impact you. SCE has reached out to the customers that would be impacted by that. It does not impact the town of Mammoth Lakes. It's really limited to some of June Lake, a little bit of outside Bridgeport, and then down at the Inyo County line. So that if that does happen, it would be tonight. We don't know that it will, but people who are impacted should already know about that.
Thank you very much, Sheriff Braun. We do have our esteemed colleague from the Economic Recovery Branch. Alicia, would you like to give us a update?
I think everything has been pretty much covered. I think I had a question for the Marine base. I'm wondering if you could briefly go over your COVID-19 protocols. I'm sure there's a pretty hefty handbook on those guidelines, but maybe that would be interesting for folks to hear.
Okay, thank you for the question. So also on the line with us is the officer in charge of our clinic here at the base, Lieutenant Mike Gumpert. He's a medical provider there at the clinic, and he can speak more specifically on the COVID-19 protocols that are used within the DoD. But by and large, I'll answer the question generally that they are guided by the Center for Disease Control guidelines, and then applied with some, I suppose, minor modifications for military, for military purposes. So, Mike, if you please can follow up. Thank you.
Good evening, everyone. Lieutenant Mike Gumpert. I'm the OIC of the Branch Health Clinic up here on the Mountain Warfare Training Center. As Lieutenant Colonel Arnold did mention, the COVID-19 protocols that we use Navy-wide we get it from multiple sources. We get it from the CDC, and then we also get it from the military medicine, specifically the Navy's Bureau of Medicine and Surgery, or BUMED. And so from a protocol standpoint, what we do is we also maintain the categories of PUI, quarantine, and isolation. So if someone comes in and is suspected of COVID-19, they would become a PUI. We would conduct a test and put them into quarantine while that test is resulting. If it results in positive, we would conduct contact tracing, which we do inherent to our clinic here. It's an organic capability we have to identify close contacts per the CDC definitions of within 6 feet for greater than 15 minutes over a cumulative of 24-hour period. So 15 minutes within a 24-hour period if you're in a position where you're not using PPE. Any identified close contacts would go into quarantine for 14 days from the period of their last contact with that positive case. And then we check up with them daily to make sure they're not showing any symptoms. As testing capability for us in our clinic has increased, we've actually started to test close contacts as well, which has allowed us to kind of help branch out on that as well, look for any kind of asymptomatic transmission that may or may not be occurring. And then if someone is positive, they would go into isolation. While in isolation, CDC and BUMED protocol says the infectious period starts 10 days from the onset of symptoms. So we go out the 10 days from that. And then we also have 2 additional caveats, which is you can't have a fever for the last 24 hours of your isolation you cannot have a fever. And that's without the use of fever reducing medications such as Tylenol, and also an improvement of symptoms. So those are the different criteria we use here from kind of a public health and medical management standpoint of COVID-19. I hope that answered the question.
Thank you. Thanks.
Thank you, Lieutenant, and thank you, Alicia. Do we have any other questions in the queue?
Currently, I do not have any more questions.
Okay, is there anyone else before our hour is almost up? Is there anyone else who would like to give any kind of staff report of any kind?
Brian, would you like to provide an update on testing with us being sort of in between?
Sure.
Yeah, labs. Yeah, thanks.
Yeah, that makes good sense. Thank you, Dr. Boo, for bringing that up. So the lab we were testing with, which was UCSF in San Francisco, stopped doing COVID testing on October 31st. And we quickly came up with a contingency plan of temporarily using San Joaquin Public Health Lab. But unfortunately, there are limits to the amount of tests we can actually send them. So we can only send them, 40 tests 3 times a week. However, we are currently in the process of onboarding with PerkinElmer, which is the gigantic state lab for COVID testing. I'm sure some of you have seen the pictures of it and the articles that were out on November 1st, which was the ribbon cutting. I know, Stu, you had that posted, I believe. And that's going to, there is basically a very high limit of what we could send them. And we anticipate that within a couple of weeks, hopefully, being hopeful, that we will be online with them. We'll have an MOU in place. And that's for public health testing. We are also requesting service from a group called OptumServe. And they are a testing group that would come to the county and do testing. Very similar to Verily, where it would be, a self-observed self-collection, so a self-test, with fewer restrictions than Verily. So OptumServe would be able to do individuals under 18. Apparently the registration is not as challenging and difficult as it has been with Verily. So we hope to also be online with them within the next few weeks as well. We are actually looking to share that service with Inyo County because with OptumServe, we have to do 165 tests a day, which is a high number. So what that would really mean is that probably OptumServe would be stationed in Mammoth, it being the biggest population base, and public health testing would kind of be the mobile testing for the rest of the county. So, public health would be traveling to Walker, to Benton, to Bridgeport, to other communities to do testing. And OptumServe would mostly be stationed out of Mammoth Lakes. So hopefully, Dr. Boo, did I cover that enough? Did I miss anything? All right. It's been a long day, so sometimes you miss things towards the end of the day when your mind starts to go. I do see we have a couple questions in the queue. If my panel is willing, I'd like us to answer those questions before we sign off.
When will the follow-up be provided to the public regarding the meeting tomorrow?
Pretty much, I would assume as soon as we actually have some substantial confirmed answers, we will get that information out as quickly as possible. And I see Chair Corliss and Tom Boo have turned off their microphones. Ladies first, go ahead, Chair Corliss.
Thank you, Brian. I just want to remind everyone that Tuesday we have a Board of Supervisors meeting right here on Zoom starting at 9 a.m. And we will have, as we always do, as we have since March 17th, a COVID update. And I would imagine, and Brian, that we will discuss this very topic then, and it happens early in the meeting agenda. You can go to monocounty.ca.gov and click on the meetings link to get the information to join that meeting via Zoom. But that will be one opportunity to hear the update.
Thank you, Chair Corliss. Stuart, can you put that link in the box for all the attendees? And go ahead, Dr. Boo.
Yeah, so I just wanted to say that I don't expect tomorrow's discussion to be definitive. I think that this decision, as I mentioned before, will be made with the involvement of the governor's office, right? So Dr. Pond is the acting state public health officer. She reports to Dr. Ghali, who Supervisor Peters has had Dr. Ghali's ear about this situation recently. And so I think Dr. Pond and her team will confer with Dr. Ghali after we have a good, open, transparent discussion about the COVID-19 situation in Mono County and why moving to more restrictive tier would be the wrong remedy for the current situation. And then I think Dr. Ghali would probably have to consult with the governor's office before we have a final decision. So no promises on when we'll have a final decision, but we're having important discussions continuing tomorrow.
Thank you, Dr. Boo. And I do see we still have a couple questions, so let's move on to the next question.
Suppose California cases in other counties go up a lot. Will Mono County restrict outsiders to protect residents from the virus?
Go ahead, Sheriff.
We can't. We can't. We tried. I mean, we talked about it when it first all happened. We talked about closing down 203 or closing down 395. We don't have that capability. We cannot restrict movement in and out of our county, in and out of our state. We just don't have that capability or the legal authority.
Right. And so the only, if there was great concern that, visitors were putting our local population and our hospital healthcare at risk, the only tool that we have would probably be, what we had to resort to early in the pandemic was pretty draconian restrictions on lodging. And we hope not to do that because of the economic effects. But anything is potentially on the table as we go through this pandemic.
Thank you very much, Dr. Boo. So do we have any more questions in the queue?
Not at this time, Brian. Thank you.
All right. Would any of my panelists like to make any closing comments before we sign off? All right. Well, I'd like to thank Lieutenant Colonel and the Lieutenant and Colonel Whitman for being with us tonight. I'd like to also thank Supervisor Peters and Chair Corliss for being with us tonight. And, just a reminder to everyone to wear a mask and distance and all those things that we've been talking about for weeks so we can stay open. I see Dr. Boo giving the thumbs up. On a personal note and a selfish note, I really would like to ski a lot this winter. So a lot of that relies on our behavior. So keep that in mind. So until we meet again, Mono County, take care of yourselves and each other. Have a great evening.
Thanks, everyone. Thanks, Brian.
Thank you.
Thank you, everyone.
Thank you.
Thank you.